Basically, it's going to give you some updates on cases now, and then I'll give you some updates on vaccination, which we have some news to share with you. Essentially, today in Ontario, we had a large increase, 4,249 cases, and there's an asterisk beside it. There's some corrections. That's a huge increase from yesterday. We were hovering around the 3,000 mark, and again, most are in GTA. Toronto had 1,382 cases, and Peel and York and Durham were leading the way as well. Donc, au niveau des cas, on voit une augmentation immense depuis hier, 4249 cas avec un astérix. En effet, Toronto n'avait pas déclaré des cas avant, donc je pense qu'ils ont tous été mis dans une journée, donc peut-être l'augmentation n'était pas si pire. Par contre, on est dans les 3000 encore, donc ça se stabilise là, mais c'est une hausse numéro à se faire stabiliser. That's where we are with that. In terms of our local numbers, again, I want to go over them and I want to spend some time with our local numbers today. We just want to give you a bit of a caveat. We had some technical difficulties yesterday with our computer system and our data from CCM, which is the data management system for COVID, and we were not able to update our site yesterday. And then we made some corrections because we had overcalculated some numbers because there were duplicates over the past weekend. So right now and that's why yesterday our statistics weren't accurate in terms of neither hospitalization nor ICU admissions, nor the numbers. So today, they reflect today's accurate numbers. And so, juste pour dire que hier, on a eu des problèmes techniques, donc on n'a pas mis nos sites web à jour, ni au niveau des hospitalisations, ni au niveau des cas en total. En effet, vous allez voir, on avait enlevé quelques chiffres aussi, parce qu'on avait des duplications pendant la fin de semaine. So we're now at 565 cases with 565 active cases, a total of 1,805. We have 15 hospitalized and 3 in the ICU at this point in time. Most of these are they're actually virtually all in Cornwall. We're actually now looking at outbreaks where you can see the numbers going up. So we could see the numbers going up sharply in the Cornwall area. They've gone up in SDNG as well. They've gone up in Akwesasne, in Prescott-Russell. But you could see kind of a bigger steep increase in the Cornwall area, less so in the SDNG area. And you can see in Akwesasne, we've gone up as well. And that's because there is a long-term care outbreak over there. If we look at the changes, again, we've added a total of 51 cases over the last 2 days, and 17 were added Prescott-Russell, 10 in SDNG, 14 in Cornwall, and 10 in Akwesasne, most of them, again, related to the long-term care outbreak over there. Donc, au niveau des cas, on est rendu à 565 cas actifs. Nous avons 1805 cas de total depuis le début du pandémie. Nous avons 15 patientes hospitalisées avec 3 soins intensifs. Presque tous sont à Cornwall. Nous voyons aussi une augmentation importante. On le voit ici. Je vais vous montrer ici un peu au niveau des cas. Donc, on peut voir ici, comme dans la région, on augmente pas mal depuis novembre. Vous voyez la ligne rouge ici. Surtout, on voit une augmentation aiguë ici à Cornwall. On voit aussi une augmentation à SDNG et à Prescott-Russell qui est pas mal plus plafondée si on compare aux autres régions. À Akwesasne, on a ajouté des cas parce que c'est surtout au niveau de la maison de longue durée là-bas, on a un flambé actuellement. Donc, depuis les derniers 2 jours, nous avons ajouté en effet 51 cas, 17 à Prescott-Russell, 10 à SDNG et 14 à Cornwall et 10 à Akwesasne. Et je vous disais tantôt, c'était plutôt relié au flambé qu'on a actuellement à la maison de longue durée à Akwesasne. Au niveau des moyennes, qu'est-ce qu'on voit ici? C'est que ça, c'est les moyennes qu'on appelle de les derniers 7 jours sur 100 000 personnes. Et vous pouvez voir que on a une tendance d'avoir une diminution. Donc ça, c'est à mon avis une bonne direction. Par contre, on est pas mal haut au niveau de la moyenne. Le bureau de l'Est Ontario, on est à presque 125 et vous voyez la ligne rouge est à 40. Donc ça, ici, toutes les zones ici, c'est les zones gris selon les chiffres. Mais je suis un peu soulagé de voir un peu une tendance à diminuer au niveau des dernières statistiques que nous avons. So you could see here, this is the 7-day rolling average where, again, we've got clearly above the red zone. This is really gray zone territory. You can see Cornwall is kind of the highest one and going downwards now, but by far you can see Cornwall in terms of per capita increases over the last 7 days. But again, and then overall, the orange one here brings us to about 125 cases per 100,000 over 7 days. And you can see there's a bit of a tendency downwards, which is good, and I'm hoping we can see that moving forward. But again, clearly this is in gray territory with Cornwall leading the way, being higher. And you can see we've got hospitalizations in Cornwall. And so we're seeing an increased sort of tendency in the Cornwall area. Again, if we go to our map, then we can see again where we have our active cases. Again, Cornwall leading the way here with 180 active cases. We've got the active cases in Akwesasne again due to that, but we also have significant active cases in Glengarry, and we still have our a fair number of active cases in Prescott-Russell, and we also have in Dundas, both Dundases. Donc, on peut voir ici au niveau des cas actifs, on a à Cornwall, on a 180 cas actifs dans notre région. Et nous avons des cas actifs à travers de notre région. Vous pouvez voir Glengarry, à Dundas et à Prescott-Russell aussi. Donc, so that's where we are with our numbers. Again, one of the things that I just wanted to share as well is that we have been working internally with our staff, and we have now we will be releasing next week, actually on Monday, data which will be sort of down on sources of infection, transmission, place of transmission, percentages of where these were, so we can better share where they are. But I can just tell you again, most of them are close contacts at this point, and we will be again looking at those at the data early next week. We were going to do it earlier, but our staff is now being redeployed to look at our vaccine rollout, which I will talk about. Donc, au niveau des chiffres qu'on voit, vous voyez, on a pas mal des élévations, surtout à Cornwall, avec des hospitalisations. Donc, c'est une condition, on a une condition importante, sévère dans notre région, surtout à Cornwall, mais les autres régions, les autres coins de notre région aussi. Donc, ce serait une autre raison de continuer avec ce qu'on fait actuellement, le plus possible de rester chez vous, de sortir seulement pour des fins essentielles, etc. Au niveau des sources des cas, notre équipe est en train de travailler, de faire un document pour la semaine prochaine qu'on va partager pour démontrer où on a la plupart des cas par Cornwall, SDNG et Prescott-Russell, de voir où ça vient la plupart des cas. Et au niveau où ce qu'on voit, c'est plutôt le contact de proche, mais on va le partager, on va avoir plus de détails. En effet, j'étais pour le faire aujourd'hui, mais notre équipe était un peu occupée aujourd'hui pendant qu'on est en train d'organiser nos cliniques de vaccins qui vont commencer la semaine prochaine, et je vais parler pour ça tantôt. Just before I go on the vaccines, just want to go over a bit of our outbreaks. We have multiple outbreaks in our area. I think at this point, I'm just going to look at I just want to remember it is. Yeah, we have 15 outbreaks at this point in time. Most of them are in long-term care facilities. And again, the ones that we've added are again not in residence; they're in staff, and that is, to me, that's better. But we do have the outbreak in Akwesasne where we have 13 positive residents and 10 positive staff. We've got at Lancaster, we have 28 positive residents and 10 staff. And again, we're working with that institution. However, the other ones that are an outbreak that you could see on our website really have no residents, with the exception of Glenstore Dunn Lodge, which has 7 residents and 6 positive staff. But again, we're continuing our next round of testing. We've done a second round, and we're going to continue with the testing there. The other ones, like I said, are I'm seeing here, they're usually they're positive because the staff are positive, either 1 or 2. Most are 1 staff, and by definition, with the new outbreaks, we are now declaring them as outbreaks. The Maxwell one as well. The Maxwell Manor has basically we've retested on the 5th and 6th, and some results are pending. Most are negative. Again, no residents there, and we had 3 staff that were positive there, and so we're just waiting on that one. That outbreak was declared on December 30th, and we're still just monitoring that again. So again, most of them I don't like the fact that we have 15 outbreaks, but again, the majority don't have residents, and I'm hoping that it stays that way. But the ones that do have residents, we're working with the homes to ensure that the protocols are in place, support is in place. Donc, au niveau des maisons de longue durée, des flambées, nous avons 15, mais je peux dire que la plupart des flambées ont été déclarées à cause que, au niveau du dépistage de routine qu'on fait au niveau des employés, on a trouvé des cas positifs chez les employés et non résidents. Et malgré qu'on avait retesté tout le monde, jusqu'à date, la plupart de nos flambées dans la maison de longue durée ont aucun résident est positif. Par contre, on a des résidents positifs la maison de longue durée à Akwesasne, avec 13 résidents qui sont positifs et 10 employés. Lancaster, maison de longue durée, on a 28 résidents qui sont positifs avec 10 employés. On travaille avec cette maison afin de continuer à donner le support de contrôle d'infection et support au niveau des ressources humaines. En effet, parmi les autres, Glenstore Dundas Lodge, on a 7 positifs au niveau des résidents et 6 au niveau des employés. Et encore, on fait nos retests et les précautions en place. Les autres maisons de longue durée, maisons de retraite, ont aucun résident positif, sont en effet, comme je dis tantôt, les employés qui étaient positifs, et on fait de routine les manœuvres de routine qu'on fait quand on a déclaré une flambée. So now I'm going to go to vaccines, and I have a bit more news to share with everybody. As I told you in the beginning of the week, we were told that we would be receiving vaccine in our area, and again, it's being prioritized to areas that are red and gray, and as I showed you, we're in the sort of the gray area at this point in time. We initially were told we were going to get a vaccine supply next week, and it's still happening. We were told it's going to be Pfizer, and we're expecting a tray of Pfizer vaccine to be sent to us next week. I believe it'll be Tuesday. And one of the things that has changed since the last update that I gave you was we now know we have guidelines as to how to transport the actual Pfizer vaccine from one site to another, and that allows us now to actually, as of next week, and I can't tell you the exact date because we're expecting delivery on Tuesday, we were initially told Monday, but it's likely going to be Tuesday. But as soon as we receive the vaccine, what we'll be doing is it'll go to a freezer, but we will be taking out dosages that can then be transported, thawed out and transported at a regular 2 to 8 degree, portable fridge, and then subsequently, delivered to where we're going to be doing the vaccinations. Once it's in that state, we have 5 days So it's good for 5 days once it's thawed out. So what we'll be doing as of next week, we will be, and this is based on our direction that we got from directly the General Hillier himself this past week, is that we'll be focusing on our long-term care residents, employees, and essential visitors. And as of next week, as soon as we have it, we've already made arrangements now. We've got everything going that we will, our EMS, both from Prescott-Russell and SDNG, will be deploying with our staff the vaccine to our long-term care facilities. That will start again, like I said, middle of next week, where we will vaccinate all these individuals, and I'm looking forward to that, because this is these are our most vulnerable, and they're going to start next week. We're also going to be getting supply for long-term care homes in Akwesasne as well, and we're working with the health department there, and they will vaccinate them as well next week. So I think that is very good news. So that's how our campaign is starting. We are going to be receiving Pfizer vaccine on a regular basis moving forward, and then we'll be able to progress. And so the first swath is what we're doing. We're doing long-term care and retirement homes. We've also asked the ministry to give us extra vaccines so we can start with our frontline workers at our hospitals, so especially workers and healthcare workers who are working with COVID patients in our hospitals in Cornwall and other hospitals as well. So I'm hoping to get a vaccine supply for them as soon as possible. I've spoken to the ADM, the Associate Deputy Minister. I've sent requests, and we will be getting some news shortly for that. But the main focus of our first swath of rolling out is the long-term care facilities, healthcare workers, First Nations, and individuals receiving home care who are chronically ill at home. Donc, au niveau des vaccins, on va recevoir les vaccins la semaine prochaine, soit mardi probablement, et on va changer un peu le processus qu'on va le faire. On a eu un mandat de commencer à vacciner le plus vite possible les maisons de longue durée. On avait pensé que ce serait difficile avec le vaccin du Pfizer, mais nous avons eu maintenant les nouvelles protocoles qu'on pourrait déménager, on pourrait prendre des viales de Pfizer en dehors de congélateurs, et à un moment donné, une fois que c'est fondu, on pourrait l'utiliser dans 5 jours. On a 5 jours dans un frigoridateur ordinaire 2 à 8 degrés. Donc ça, c'est des bonnes nouvelles pour nous. Donc, ça va arriver dans notre région la semaine prochaine. Nous allons, avec nos partenaires paramédics de IMS, de SDNG, Cornwall et Prescott-Russell, on va distribuer les viales, le vaccin à la fois pour chaque maison, et ils vont rentrer aux maisons avec nos employés aussi pour supporter, et on va vacciner les résidents et les employés et les visiteurs essentiels dans nos maisons de longue durée. Et ceci va commencer la semaine prochaine, et on va continuer. Nous allons recevoir aussi pour Akwesasne, les maisons de longue durée vont être vaccinées là aussi. Et aussi, on a dans la première tranche de ce vaccin, ça va être la première phase qu'on appelle. C'est plutôt, on va viser les maisons de longue durée. Après ça, on va faire la maison de retraite. En même temps, on va commencer à vacciner. J'ai demandé de vaccins exprès pour nos professionnels de la santé qui voient les patientes aux 4 hôpitaux surtout. On va commencer avec ça. Et aussi pour les Autochtones, comme j'ai dit tantôt. Et aussi, on va avoir les vaccins. On va commencer à vacciner les personnes qui sont à la maison, qui reçoivent les services à la domicile chronique et compliqués. Donc, je suis très heureux qu'on va commencer avec ça, et qu'on va commencer avec même le vaccin du Pfizer qu'on pourrait maintenant déplacer du congélateur de moins de 70, et on aura 5 jours pour le faire. Donc, ça, c'est de bonnes nouvelles pour nous. J'ai hâte de recevoir le Moderna aussi. Apparemment, on va recevoir le Moderna. Je ne suis pas sûr quand on va le recevoir. Le Moderna va être plus facile. Ça prend un congélateur de moins 20. pas moins 70. On a des congélateurs pour ça. Et une fois que on le sort du congélateur, c'est bon pour 30 jours dans les températures usuelles qu'on utilise. Donc, avec ça, ça va nous permettre d'avoir beaucoup plus. Une fois qu'on se rend au niveau des quatre tranches qu'on appelle, là, on va rentrer aux deuxième phase où on va commencer à vacciner les personnes de travailleurs essentiels, non médicales. Et aussi, on va commencer avec les tranches d'âge. Mais on n'est pas là encore. Nous, on a jusqu'à le 22 janvier de donner nos plans au niveau de vaccins au ministère. Mais au moins, on commence la semaine prochaine et j'espère recevoir aussi pour nos médecins et nos infirmières et tous les employés qui travaillent, qui sont face à face aux patientes dans nos 4 hôpitaux. Ça, c'est mon priorité aussi. So we're basically hoping that we get the Moderna vaccine as well. The Moderna vaccine will be a bit more easier. You can put it in minus 20 freezers, which we have. And the thing is, once you take it out and thaw it, it's actually good for 30 days. And so it's easier to transport. It's easier to store in other areas. And so we're hoping that we'll be getting that soon. I think that as a next step, we're going to be going to, once we do those first in the first phase, second phase, we'll then be looking at essential workers and different age groups. So that's to come in next month. This month, we'll be concentrating on what I talked to you about. Again, the rate limiting factor is vaccine availability. It's trickling in, but it will start to go up, we were told, towards the end of the month. And I know that there'll be approvals for other vaccines probably over the next couple of weeks as well. So we will, rev up our plans moving forward. So that is good news. Again, I can't give you the exact date of when we'll start. We're hoping if we get it on Tuesday, we're going to start on Wednesday, and we're going to go weekends working to make sure that we vaccinate as many people as possible, and then we'll be getting regular trays of vaccine committed to us to the end of the month. And so we're going to be moving forward with that, and I'm very much looking forward to that. Just a word of caution in that we're sort of, the good news is that we have a vaccine literally in our hands. The bad news is that our numbers are going up. And so at this point, to me, it's a light at the end of the tunnel, but we still have to buckle down. And as you know, part of the other mechanisms yesterday it was announced that the school is being elementary school at home learning is prolonged until January 25th. And we're going to be keeping a close eye on these numbers. Hopefully we won't have to institute other restrictions or any other further lockdowns like Quebec is doing tomorrow. I'm encouraged by just a slight decrease in our numbers, but make no mistake, we have high levels in our area, particularly in the Cornwall area. Donc, je vais encourager le fait que nous avons le vaccin effectivement dans nos mains, presque, mais je suis découragé au niveau des chiffres qu'on voit à travers de notre région, et on voit ça à travers d'Ontario et Canada. J'espère que même si on voit une petite diminution de nos cas, j'espère que ça va continuer, mais en effet, nous avons une hausse niveau d'infection dans notre région, surtout à Cornwall, mais partout, mais surtout à Cornwall, vous avez vu les chiffres que je vous ai montrés. Donc, c'est le temps de ne pas lâcher. Il faut continuer avec nos mesures de santé publique. Et aussi, vous avez constaté qu'hier, on a annoncé que l'école élémentaire va continuer à se faire à la maison pour une autre 2 semaines. Donc, j'espère que d'ici une semaine, on va voir un progrès à la bonne direction. Et de notre côté, qu'on aurait plus de vaccins pour vacciner les gens. So that's our news update now. I have some questions here that I'm going to be answering. I've actually answered most of the questions here. The question here is, there's a rumor circulating that grocery stores are about to be limited to curbside pickup and delivery. Is there any truth to that? No, at this point, I don't know anything about that. There's no truth about that. One of the things I just wanted to say is that, again, today, In some of my meetings, I brought up again the big box stores, the discrepancy that we're getting a lot of complaints about that. I've been my recommendation again, and we're gonna we repeated it today during our ministry meetings, that at this point, just for equitable reasons and also decreasing the number of people, big box stores should be limited, just like in Quebec, to selling essential goods only. Hopefully that the government will listen to us and be able to do that moving forward. I answered the next question in terms of the list of vaccinations. There's a question here about hockey, but hockey is out at this point, so I'm not going to answer it. Max Romano, I talked about, and I talked about the data coming out, and our frontline workers being vaccinated in Ottawa before retirement home residents. I can't comment to that, but I can tell you that our mandate now is to vaccinate long-term care first, obviously. But I'm like as much as possible to get some vaccines for our frontline workers. They're both at the same sort of same level in the phases, but that's our marching orders that we have for now. But I do want to get vaccine for our frontline healthcare providers, and I'm very optimistic that we will as well. I've spoken to the hospitals, and they're all set to go, and they just need the vaccine. What dates? Okay, and the other one was a rollout of vaccine in our area. So that's it. I will open it up to questions. Si vous avez des questions, allez-y. Nick?
Okay, Dr. Paul, we have a first question from Nelson Zadenbergen from Nation Valley News.
Hi, Doctor.
Hi, Nelson.
How are you?
I'm good. Yourself? Busy?
I'm not bad. Happy New Year.
Same to you. Same to you.
I was wondering about, you just mentioned there again, the possibility or your desire to see non-essential goods roped off at Walmart and these places. On that matter, what about Section 22 orders? Are you contemplating using your Section 22 powers to affect that, as well as a curfew? That comes into effect Saturday in Quebec. Yeah.
I thought of that. I don't think that for that type of approach that I would want to do that. I would rather it be a provincial regulation for that. Just like Quebec did, and Quebec was upfront about it. I remember Premier Legault saying, we want to have an even playing field, and that's why we're going to do that, and I agree. So I would rather it be a provincial thing, because then if we do it in our area, then others will go to they'll still go out, they'll be traveling. So I'd rather it be across the board. What was the second question?
Yeah. Just to follow up on that, Quebec's controversial decision to ration their vaccine, 1 shot per person, apparently. Are you worried that that's going to drive Quebec residents over the border in search of their second booster shot, that they won't be able to get at home?
They won't be able to get it here.
Okay. So I presume then there are protocols in place. People have to live in the region in the EOHU.
We need to have your OHIP card and all that. Yeah.
Okay.
Yeah. Well, they would fall into likely frontline non-medical workers. So they would probably be in the second phase, which probably would occur in probably February or so. That's kind of, I'm guessing at this point. And if they're and the other thing too is if they're elderly as well, they just the fact that they're elderly will have a age group sort of 80 and 70 and 60 and below, those type of things. So we anticipate, and again, it all depends on the vaccine. Like I keep telling, the general showed us a little map of saying, okay, we believe like January to February, March, this will happen, and then moving on. I believe that that may move a bit earlier depending on vaccine supply. And if we get like another company approved earlier than later, those timelines may shift a bit earlier, which I'm hoping.
Okay, next question we have is from Philip Blanchard with The Leader. You can go ahead, Philip.
Hi, Dr. Paul.
Hi, Philip.
So first question is regarding healthcare workers, frontline workers. Will workers be vaccinated based on what health unit they work in or they live in? Because there's a lot of healthcare workers that cross boundaries, like into Ottawa or Leeds, Grenville, Lanark, that live here, and vice versa.
We will be vaccinating as a first swath whoever works at our 4 hospitals. Let's put it this way. Wherever you live, doesn't matter. If you work at the hospital, you're going to get vaccinated.
Okay. And second question is community living Winchester. It still shows as being unknown respiratory. Do you have any more details about that, if it is COVID or not? Or
sorry, which one was it, Philip?
The outbreak at community living Winchester. It still says on the EOHU website that it is unknown respiratory.
It means it hasn't come back positive, and hopefully won't come back positive at all.
Okay, and what's your R0 number?
1.45, I think. I had said it hasn't changed. I sent it to you the other day.
It's 1.42 on Monday.
Yeah,
so
yeah, it's about the same.
Okay. All right. Thank you. Have a good weekend.
No problem. You too.
Our next question comes from Jordan Haworth with the Cornwall Standard Corner Freeholder Standard Freeholder.
Mm-hmm.
You can go ahead, Jordan.
Hello?
Go ahead.
Can you hear me?
Yeah, I can hear you. Go ahead, Jordan.
So my first question is, why are critical care unit cases at the Cornwall Community Hospital not being reported as cases in ICU on the EOHU website?
They are. There's 3.
Okay, and that's the total?
Yeah, there's total 3. Yeah. As a matter of fact, I think 1 just got moved, but there's 3.
And last time you said that there were some risk criteria that you were going to use to determine which patients at long-term care homes would be vaccinated first in this first round. Will those criteria be released to the public?
They're the same criteria that we use to basically rate the risks of the homes.
Okay.
Okay. Thank you.
Next, we have a question from Nick Seabrook with Seaway News.
Okay.
Hi, Dr. Paul.
Hi, Nick.
So my question is, will you be releasing more information in regards to contact tracing about where people are getting contracting the virus and how they're getting it, stuff like that?
Yes, on Monday.
Okay.
I was hoping to have it today, but because we had a bit of a change in the way we're going to be distributing the vaccine, because initially we thought we were going to set up separate clinics. We had to deploy staff to start organizing that, because we had to send out all the consent forms and all of the paperwork required for there's about 1,500 long-term care residents. We had to, and then another 2,200 staff. So we had to get consent forms and everything organized. So we put it aside. We're going to release it next week.
All right. Thank you very much.
No problem.
Okay, that's it for the questions from the chat. People joining by phone, if you have any questions, you can press *6 to unmute yourself and ask your question. Si vous avez des questions par téléphone, vous pouvez appuyer sur l'étoile 6 et poser votre question au Dr. Pell.
Well, okay, so don't forget, then our next one is on Monday.
Sorry, I've got a question, but I'm not on phone, so...
Okay, go ahead. Where are you from, Thomas? Where are you from?
Radio-Canada, en fait, j'ai intervenu en anglais. Là.
En français, vous voulez?
Oui, c'est ça, j'aurais besoin d'une réponse en français. Pardonnez-moi. Oui, c'est une question par rapport aux hôpitaux. On voulait savoir, en fait, là, parce qu'on a vu des hôpitaux à Ottawa qui semblaient commencer à être débordés. On voulait savoir s'il y avait des hôpitaux de l'Est ontarien qui pourraient accueillir des patients de d'autres régions.
Pour le moment, non, parce que déjà à Cornwall, on a débordé. On a 15 patients hospitalisés, sont presque tous à Cornwall. Les autres hôpitaux sont pas mal débordés, d'autres choses aussi. Donc, la capacité n'est pas là.
D'accord. Et juste un aspect un peu technique, là, parce que c'est mon premier point de presse avec vous. Les chiffres que vous nous avez donnés, je veux dire, c'est depuis combien de temps, en fait, cette augmentation-là? C'est pas d'hier, de ce que je comprends, là.
Oui, en effet, écoutez, à chaque jour, on rajoute des cas. On avait un problème technique, donc ça représente 2 jours d'augmentation des cas, mais jour par jour, on monte dans notre site web les augmentations des cas, aussi au niveau des cas total, les cas actifs, et nous avons une autre section sur notre site web qui donne dans quel comté, Uni ou Cornwall, on a eu l'augmentation combien. Aujourd'hui, on avait, comme je l'ai dit tantôt, on avait, je pense, 41 cas ajoutés et on sépare de où ça vient ces cas.
OK, d'accord, c'est bon.
Dr. Paul, we have another question from Philip Blanchard, the leader.
Dr. Paul, today during his press conference, Premier Doug Ford said that the province is going to run out of the Pfizer vaccine by the end of next week. So does that cause you concern for supply chain after this initial dose that you get on Tuesday?
Well, I think that they're taking into account the vaccine that's already been allocated to us, and I've been allocated to the end of the month. So I think he's counting that in there. I'm hoping he is. But I received written confirmation that we'll be getting weekly vaccines till the end of the month.
And that won't get.
I don't think it'll get affected. No, because they're counting what they've already allocated and what they have total.
Okay, thank you.
Okay.
Okay, we have one question from Nicole Williams with CBC. You can go ahead, Nicole.
Thanks. Hi, Dr. Paul. I'm
Hi.
just wondering, I know Premier Ford earlier today said that hospitals, probably in regions like yours, might have to prepare for an influx of ICU patients from other jurisdictions. I'm wondering if hospitals in your region are prepared, and if so, what are they doing, and how many beds might be available?
Well, we have in our area, our regional COVID ICU is the Cornwall Hospital, and already they've had 3 in the ICU, and they've had 15 patients in total in the hospital. So they're starting to increase their capacity as well. So it might be difficult to accommodate further patients. I don't know the exact ICU capacity of the hospital, but I do know I spoke to the chief of staff literally this afternoon, and they're starting to get increased numbers as well. So this is, you have to understand that our region is huge, 5,500 square kilometers, and the Cornwall Hospital itself has been the designated COVID regional ICU. So it'll be very hard. Obviously, they work together and they look at capacity, joint capacity. But that's something that I know that they meet regularly, and they try to see where we can accommodate patients.
Thank you so much. And I'm just wondering, and forgive me if you mentioned it already, can you tell us exactly how many doses of the vaccine we're getting next week?
I'm getting 900 and, okay, it's going to be close to 11, okay, 950 doses if you do 5 per vial, and it'll be about 11, and then it'll be close to 1,200 if you do 6 per vial. So we were meeting with Pfizer this week and learning how to make sure that we put enough diluent and how many needles and size needles to get the 6. So if we get 6 out of them, it'll be about 1,150 or so.
And are half of those going to be saved for the booster shot, or are you waiting for a second shipment?
No, we were asked to deliver whatever we get. And we were told that I've been told my allocation is secure till the end of the month.
Thank you so much.
You're welcome.
Do we have any other questions from someone from the chat box or by phone? On a-t-il d'autres questions? That looks like that's it for today, Dr.
Thank you very much, everyone. Bonne fin de semaine. Bye-bye.